Hi everyone, today I'm here with Dr. Eslami, a bariatric surgeon. So Dr. Eslami, thank you for joining us today.
You're welcome. Thank you for the time.
Oh yeah. Before we get into kind of the specifics of your specialty, could you just kind of give us an overview of what bariatric surgery is, since a lot of people don't really know?
Bariatric surgery is a field of treating the obese patients surgically who are suffering from the obesity and overweight, and they have tried the other modalities to lose weight, and the attempt hasn't given any success. So bariatric surgery is the field that we perform different type of surgery for people that they've been struggling with their weight loss, help them achieve their goal weight.
Okay, so before going into the specialty in detail, could you give us an overview of kind of what led you to medicine and bariatric surgery in particular?
Well, in the beginning, bariatric surgery is a new field, but I knew from the first day of my medical school that I am going to be a surgeon. What kind of a specialty still was not determined because, as I said, you need exposure and you need to evaluate yourself and assess yourself as a medical student and as a resident before you jump into the subspecialty. But going to the medicine and going to the surgery, I knew even from my earlier age that this is the field that I'm going to end up going to.
Bariatric surgery is a subspecialty of general surgery?
Correct.
And what other subspecialties are there?
So once you finish your general surgery, which is a common pathway for subspecialty, which is 5 years of residency, then you have different options. You can go to trauma surgery, you can go to bariatric surgery, you can become a laparoscopic surgeon, you can go to cardiothoracic surgery, plastic surgery, oncology, colorectal surgery. So those are the fields that we have basically available as a subspecialty once you complete your first 5 years of general surgery.
Okay, so do you stick to bariatric surgery or do you do other kind of things too?
Well, I'm an advanced laparoscopic / bariatric surgeon.
Mm-hmm.
So on top of general surgery, which is my initial training, I'm trained to perform all the common general surgery problems laparoscopically because I'm an advanced laparoscopic trained. But on part of it, my training was involved in bariatric, which is another desire of my specialty. Yeah.
Okay, so you do both?
I do both, yes.
Okay. What's a typical day in your week like? And it seems like you do different things on different days, so could you kind of give us an overview of your week?
So general surgery and overall surgery lifestyle is different from the other specialty because it's so demanding and at the same time it's rewarding. So on top of the clinic day that you see the patient as a consult or post-op patients that you have performed surgery, then you have some surgery dates. Typically, I have 3 days of OR time or surgery time on a weekly basis, and the other 2 is involving the clinic, seeing the patients as a new consult or post-op patients. On those days of operations, 1 day is dedicated for bariatric surgery, and then the other 2, 1 day is dedicated to general surgery, the other one is alternating between bariatric and general surgery if I have a short. Yeah.
Okay, and then when does the day start and end usually?
Usually the OR time starts like the first case starts 7:30, so that means you got to be at the hospital 7 o'clock.
Mm-hmm.
And then depends on how many cases and the volume that you have, you finish it. So today, for example, I have like 7 cases, so I'm finishing, if there's no challenge, no surprise, by later on today, late today, like afternoon. But the problem is, on top of that, I have a commitment of being on call for emergency room for emergency surgery. So if something comes up, then I need to deal with that as well.
And how is the lifestyle of a bariatric / laparoscopic general surgeon different from other specialties?
So bariatric surgery is more elective situation compared to if you, for example, if you compare that to the trauma surgery, which is another common subspecialty for general surgeons. If you're a trauma surgeon, then you know you're going to be at the hospital and you know any minute something is going to come up. So the lifestyle is different because you got to stay away from your family, you got to stay away from, and as a matter of fact, I had the trauma surgery training as well, and I practiced as a trauma surgeon for 2 years, but again, the lifestyle was so demanding that it couldn't match my lifestyle with the family, so I basically chose to move and shift my career more toward bariatric than trauma surgery. But for example, trauma surgery is more demanding. You got to be at the hospital. The shift is longer, is more demanding, is more stressful than bariatric, which is elective. It's not emergency or it's not anything urgent that you have to jump on the patients and deal with that. But emergency medicine overall has a different type of demand compared to the other subspecialty. For example, plastic surgery again is a very calm and laid back elective type situation than the other specialties.
Do you do other things like research or things outside of your clinical practice, or do you focus on the clinical side of things?
I'm more clinical, but since I have a Center of Excellence, which is my bariatric program, I'm the program director, and then we are getting reviewed by our society, which is ASMBS, every year, coming to see our files, review the patient's outcome. So we need to keep ourselves up to date. So I have basically research assistant at the hospital, which if something we need to try something new on our patient, then a new medicine or the new skill or new surgery, for example, way to deal with the situation, then we put it on the paper and then we research that. But as a solo practitioner, private practitioner, the research is not my first priority. It's more clinical, my practice.
Okay, and do you manage the business yourself, or do you hire other people to manage it for you?
When you are solo, basically a different way to manage your practice. As a solo practitioner, I'm not employed by the hospital, so I run my practice myself. So that's a different, totally atmosphere that you never had any training for during your school. But again, this is something that you learn from your mistakes and then you master yourself. Yeah, but yeah, I run my own business and my own practice.
So how did you learn, or what tips would you give us to learn how to run our own business?
It's good actually. The only learning tip here is, again, it comes with the experience. Unfortunately, there's nothing that you can learn. But again, if you are new on the field, it's better you start with somebody and learn that kind of a technique and practice module with somebody who's been doing that for a long time, and you can learn a lot of things from their mistake rather you do it yourself. Since I didn't have anybody, I started, for example, myself, I started with one employee and now I have 20 employees. So, but again, you got to run this HR yourself. You got to be your accountant. You got to be your lawyer. So it's a different module.
Okay, and so it seems like there's still opportunities in bariatric surgery to do, and even general surgery to do private practice. Nowadays, it seems like more specialties are moving towards just going to hospitals, like bigger groups. Would you say there's still a lot of people doing private practice in your field, or is it like very
I can see the future basically is going to moving forward to kind of employed situation rather than private practice, because it's really hard, especially with the overhead, with the reimbursement from the insurance company. Nowadays, people rather stay away from private practice and its headache and issues than being involved. Since I started myself and I passed all these mistakes and problems, now knock on the wood, everything is smooth. So I'm happy. I'm not saying I won't be here 5 years from now, but again, if something comes up or any other opportunity, I may jump into that. But again, it's really hard to be a practitioner, clinician, and in the same time you be business guy and run your business. So it's a totally different atmosphere and different type of a structure.
Okay. What are the most rewarding and challenging aspects of bariatric and laparoscopic general surgery?
Well, it's a totally two different things. Laparoscopy, for example, is different. So, as a trauma surgeon, as an emergency surgery type general surgeons, I deal with the emergency situation. If you have that kind of a skill that you can manage anything surgically in an emergency situation laparoscopically, so that means the outcome, the overall outcome is going to be beneficial for the patient. For example, if I'm going to do an appendectomy, which is a very common procedure for the patient, is going to be more beneficial for the patients if undergo laparoscopy rather than big incisions and big cut, because the recovery is different, because the post-operative pain is different. So if you have that kind of a skill, then it's going to be a huge advantage for the patient. Bariatric is the same thing. So first of all, laparoscopy, you have to master that to operate on patients with overweight and high BMI and obese, because there's no way you can make a big incision, make a big cut, too much to cut, exactly, because then the recovery is different, because the post-operative complication is going to be higher. But in the same time, when you see these patients 3 months post at the office, and then you see they are off of their all the medications that they've been taking, diabetic medicine, blood pressure medicine. So, and they lost weight, and they are different percent, different looks. So that's the rewarding part of the practice.
What about the most challenging parts of your job?
Challenging is always, especially as emergency surgery or general surgery. Any case that comes to the emergency room will be a challenge, because they present differently. Nobody is exactly the same. It's like a trauma surgery. So when you have a gunshot wound to the abdomen, nobody read the textbook. This bullet may go to the liver, and from the liver go to the right kidney, or may go from liver to the left kidney. So everything is different, and everything is a challenge. And based on what you get, then you need to approach, and you need to change your strategy.
Are there any misconceptions about your field? I bet with bariatric surgery, there's probably more misconceptions maybe.
In terms of?
People think it's a certain way, but it's not how society or a lot of other doctors think.
I have seen people basically sometimes they have that kind of a misconception. But again, the problem that we're dealing with is obesity and overweight, and we need to understand that's the huge impact problem issue on our patients. So it doesn't matter how you want to get that overweight patient taken care of, but surgery definitely has to be an option on the table for them.
Mm-hmm. And so when do you decide to stop pursuing lifestyle changes or medications even, and to undergo surgery?
So that's a good question. So when people come to our office, doesn't mean that we're going to perform the surgery. So bariatric surgery is you have outcome, you have success if you challenge these patients from each angle. So you got to be a good counselor, you got to be a good dietitian, and at the same time you got to be a good practitioner or surgeon. So if you do not approach that patients from all these angles, then this is like a car that one of the tire is missing. So you need to have all these components for that vehicle to run. So my practice, my program, since I do everything myself, I have my own dietitian, I have my own counselor, and I'm a surgeon. So when patient walks into our program, they are going to be challenged and approached by all these multiple specialties before they make them a candidate for surgery. And that brings us a big good outcome.
Okay. Are there certain types of personality types or certain types of people that do well in your field?
Of course. The first thing basically we need to hear from these patients and feel from this patient is commitment. So we have a commitment, so that means this patient is ready for the change. If somebody doesn't have commitment, if somebody is not ready for the change, lifestyle change. So surgery is just a tool. We give them the tool, But again, we need to see that commitment from our patients.
Okay, and then what about on the med student side? What types of med students would be good for your field? 'Cause I bet like they need to be extra stress tolerant as opposed to doing something that maybe has more of like a lifestyle. That's more of a lifestyle specialty with like better hours or something.
So for medical students, that's a good question. So yeah, they need to understand what they want. Surgery. The reason I choose surgery because I wanted a rapid result from my patients. If I take out somebody's colon which is perforated, I can see this patient is going to be feeling better in 24 hours. So that's rewarding for me. On the other hand, it's a very stressful lifestyle because you have to deal with the sickest patient and be in the OR. And on top of it, they need to challenge themselves to see if they have that kind of skills. I remember, when I grew up, basically, in my country, I was fixing my own bicycle and my own motorcycle. So if somebody never touched any tools or any kind of instruments during their career and their life, it's going to be a challenge. You come to the OR and then you have all these instruments in your hand and then you're going to start using it. So it's really helpful. So when I did my training at University of Maryland and Hopkins, again, I see a lot of people, surgeons with good skill, and then I saw in the same time a lot of surgeons that didn't have that kind of a skill. And then when you go back in their life, you see didn't have that kind of exposure to the tools, to the instruments, compared to somebody that
work with their hands.
Yes.
Yeah. How would you recommend people get into the specialties and subspecialties that you got into? Like what career path from like being a medical student to are there any like tips or resources you recommend or?
Definitely, as I said, the first thing they need to see is are they gonna like surgery at all or not? That's the first thing. So from medical school, going to the bariatric surgery is a different type of is a big jump. So the first thing as a medical student, they need to understand, hey, am I good candidate for become a surgeon, first of all, or I need to go to different specialty such as pathology, such as internal medicine, family practitioner, which they have their own characteristic. But in the same time, if you become a surgeon, then, as I said, because we have a variety of the specialty, then during your residency, you have a chance to expose yourself and challenge yourself to see, hey, do I want to deal with cancer patients the rest of my life, or you want me enhance beauty and cosmetic for my patients, or I want to deal with obese patients and help them lose weight. So this is something that you got to challenge yourself by being in the OR, by exposing yourself to those patients to see which one you can handle, which one you can communicate, and you see yourself more matched with them.
Okay, and to get into those, would you recommend doing things like research or shadowing, or is there anything?
The best thing is exposure. The best thing is exposure. Research is good to make you qualified. However, in order to, because this is your life and this is your career, and you want to see yourself doing that rest of your life. So the best thing is exposure. And exposure means like you need to have rotations. You need to stick to a surgeon to see, hey, is this exactly the lifestyle and that kind of the patients and that kind of the surgery I'm looking forward to see myself doing, or I can see myself doing or not. So exposure and being involved one-on-one with the surgeon or with that kind of a specialty, that's the best way to go.
Okay. How well are physicians in your specialty compensated? I'm not sure if there's like a difference between the emergency general surgery side and the bariatric side, and also those kind of surgeons as opposed to like maybe let's say like a family medicine physician or like internal medicine physician or something like that.
But the compensation, unfortunately, has been really moving and struggling with the compensation. So if you look at the surgeon 10 years ago, 20 years ago, the compensation was totally different from general surgery nowadays. Comes again, since the compensation and reimbursement nowadays is very poor, then it's going to fall on you, hey, is this really a specialty that is going to inspire me and then I'm in love with and I can see myself doing, ignoring the fact of the reimbursement and the compensation. Unfortunately, as a general surgeon, yes, the compensation compared to the medical field nowadays is not that much a huge difference. So that comes on you, hey, I love doing what I'm doing, I don't care if I get paid or I don't get paid. So that's the huge determining factor that needs to come on definitely on board before our students make a decision.
One thing I forgot to ask you before was what are some typical cases that you see in a day in bariatrics and also with emergency laparoscopic surgery?
So bariatric is pretty straightforward. So there are overweight patients, they've been struggling with the weight loss. They fail the medical management and they come see you for the surgical. So there are overweight, high BMI patients.
So what procedures would those be?
So the procedures we offer, so we have laparoscopic gastric banding, we have laparoscopic sleeve gastrectomy, and then also gastric bypass.
Okay, so bypass is called bypassing parts of the stomach?
Part of the stomach to the small intestine, so it's a little bit more invasive, but at the same time it's more effective.
And what about with like sleeves?
Sleeve gastrectomy is a restrictive procedure. We remove 80% of the stomach.
Okay, so it's more effective, or it's less effective because of?
It's less effective than bypass because we don't do anything to the small intestine.
Mm-hmm. Yeah. And what was the last one you said?
Gastric banding.
Banding and how?
Gastric banding is a restrictive procedure. We put a dam around the stomach, basically, and then that can cause restriction. So big patients, they cannot tolerate the food as much.
And so is that reversible, but the other ones aren't?
The sleeve is not reversible because we remove part of the stomach. The other ones are reversible, but again, not anybody would reverse them. So it's not like I lose weight and then I come out and then I say, hey, reverse my bypass. It doesn't go this way.
So usually they end up keeping it for life?
Correct.
Okay, and does that have long-term effects where they like?
Well, they need to be watched for vitamin deficiency, protein deficiency, because they are prone for that because they lose part of the stomach. So that needs to be monitored.
Like B12 or something?
B12, folic acid, iron deficiency, so they are prone for all this.
It seems like you're in so many different areas. How do you stay on top of your field since so much research is coming out?
As I said, the sleeve gastrectomy, for example, is the most new recent study on the surgery that we are performing. But overall speaking, if something comes up because you need to keep your CME up to date and you need to go to different conferences, for example, since I do some research as well, I go to the conferences, I present paper, so you are pretty involved. So if something comes up, any new technique or new surgery or new medicine, then you learn that quickly.
And does the hospital give you like protected time for research or to go to other conferences and things, or do you have to take time off?
You take time off because it's on your own. So, but again, it's not like every week or every month. So personally, I would do twice a year CME conferences. So, and one of them is international, the other one is local in the US. Yeah.
So does that kind of end up being your vacation time, kind of? Or?
It's gonna, yeah. Sometimes you gotta include it to your vacation time as well.
You mentioned you went away from trauma because it was a little bit more like encompassing like your whole like family life and your day to day. So how do you recommend people balance their establish work-life balance and also maybe avoid burnout?
Well, that's a good question. So that's the problem. So I would say the only way we can deal with that kind of a problem is prophylaxis or prevention. So there is no way, I mean, you can balance it. You either take call or you don't take call. So if you have a family, if you have kids, if you have wife, somebody that can understand that kind of a lifestyle, so it's going to help you. But again, sometimes you don't want to sacrifice your family over your work, so then you're going to modify it. For example, me as a trauma surgeon as well, I can take trauma call, but again, I try not to because I chose family over my trauma surgery. That's something that you cannot balance it. Either you do it or you don't do it. Because if you perform surgery, if you take call, then you have that kind of a commitment. So you cannot drop that or modify it. So I come back to your life. So this is something that you understand over time. Hey, is this something I'm going to end up doing, or I need to stay away from it?
Okay, so I guess you gotta pick one sometimes.
Exactly.
Okay. So how do you recommend managing finances for physicians, either once they get out or over the long term, to be successful? Since we usually don't have classes on like managing your finances well. But
Yeah, that's one of the problems. So when you come out of school, you have a lot of loans there. So again, the best way here is you find a colleague, especially the field that you are going to end up going to, and then if you have role model or somebody you can trust, that's the best way you can. There's nothing basically structured or written. Then you can follow that kind of instruction, and then you say, hey, I'm going to be fine. So it depends on how you want to do it, because if you want to go to, for example, employment situation or be a Kaiser surgeon or Kaiser physician, it's different from if you want to be a private practitioner or solo practitioner or multi-group type practitioner. So each one has a different way to do their finance and accounting. So this is something that you need to be associated with somebody to learn from them, but at the same time, you get an accountant, you get a lawyer, so they can give you some piece of advice.
So like find a doctor mentor, but also get like a financial advisor maybe?
Correct.
Okay. So how has medicine changed since you started practicing, and where do you see it going? Are there future trends or changes? You mentioned being personally employed to not be as prominent, but are there any other changes that?
So when you finish the medical school and that kind of a training, I would say they put a lot of investment on you to teach you autonomy and you make an independent decision. And this is one of the struggles that we have. So as a physician, again, do I like that employment situation or module? No, because you lose your autonomy, you lose your independency. So as a physician, then this is going to be a situation that now we are going to deal with in the future. Because most of our physicians, because of the reimbursement, because of the insurance companies, because of all these compensations that we have in now, they are end up going to be safe, are going to that kind of a module, employment module. But the problem with that is, as a physicians, especially as a surgeon, you want to have autonomy, you want to make that kind of a decision, and that kind of a structure will allow you to become independent, because that HMO deal or that insurance company would mandate or they guide you, hey, this is how you want to do it, and this is what we want to have you do. So that's the problem that we have, and I see it's coming in the future. So that's the problem. For example, 2 years ago, we had a lot of private practitioners, solo practitioners, but nowadays everybody is shifting to more employment. And it's going to become more likely moving to that way. So, and that's because of the finance, and that's because of the compensations that we have. And then managing your own practice and dealing with your own, practice. So,
if you could go back, would you change anything about your career path? Would you choose the same thing again?
I wouldn't personally. So, for example, I did, again, general surgery, I would do that again. I did bariatric, I would do that again. I spent a lot of time in trauma, maybe I wouldn't, because I didn't want to end up doing trauma. So a lot of things that you can do. But again, the main thing here is you get yourself enough exposure as a student to see, hey, is this the field that I'm going to see myself doing the rest of my life? Do I like it? Do I love it? Can I have my life? Can I have my balance? Can I have my family? And at the same time, continue this career.
Okay, so actually this last question, what advice would you give medical students or residents to become a good doctor?
To become good doctors, you need to love your work, your job. And in order to love your work, you need, again, I stress that fact, you need exposure. You don't want to become a doctor, you don't want to become a surgeon because my family or everybody's doctor, or because my parents wanted me to become a doctor. Then you haven't chosen anything, and you don't know what your skill. So you need to see what is your strength, what is your weakness, and then work on that, and then choose the pathway that you can see, you can improve, and you can get better and better every day. And in the same time, if there's no love there, then you sign up for failure. So, and the best way for the medical students is before choosing the career, or before even becoming a doctor, is exposure. A lot of them, they think there's money there, they think I'm going to have, I'm going to be rich. But again, that's not the case anymore, because you work more than everybody else, and at the same time you make money, yes, but again you 3 times more than the normal population.
Great. Well, thank you again for being part of this interview, Dr. Eslami.
You're welcome. Thank you.
Do you have any kind of social media or links or anything that you want to include in the video?
Definitely. So I have Facebook. They can follow me, slimlifesolutions.com.
Okay.
And also on Instagram, slimlifesolution.com. So that's my social media.
Okay. Now I'll include a link in the description box for them too, so they can check it out.
No problem.
Okay. Well, thank you guys so much for watching. Let me know down below in the description box who we'd like me to interview next. Thanks again, Dr. Eslami, and I'll see you guys in the next video.
Thank you. Thank you,
Thank you so much.
You're welcome.